treatment model that Smarmore offer is based on what's known as the Minnesota model. This is the longest treatment offering that's out there. So it goes back, so that what the Minnesota model is based on the principles and understandings of a 12-step program. That means Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, and there's hundreds of them. So the principles of those are what we apply here as a bedrock of our treatment program in Smarmore. So the principles of Minnesota model is that is the foundation stone of what everybody receives, an understanding and a beginning of working of those steps as well. And on top of that then an individual treatment plan will be applied, depending on what the condition is that people present with. So there may be levels of trauma, there may be levels of attachment issues, there may be dysfunctionality at home, there may be wounds unattended to, there may be a chronic low self-esteem, which is often the case. So it goes on in terms of what the individual presentation is, and we'll develop an individual treatment plan for everybody around that. But everybody, the bedrock and the foundation stone of everything that people get here is based on the 12-step model of the Minnesota model. What that looks like on a day-to-day basis is a multidisciplinary team, which means that there's doctors, nurses, healthcare assistants, therapists, support staff, and even recovery advocates who are in recovery themselves and are there to support and to mentor and coach people through the process. So each person who comes into Smarmore receives a full wraparound of a multidisciplinary team who looks after all of their needs in a very holistic way. Because treatment needs to be holistic. It's not just about treating the mind or the body or the heart or the soul or the spirit, and all of those are important, but we need to do it together jointly in one unit and to deliver the best possible treatment experience we can to each and every person who comes through those doors. So no person is getting treated with the same. Everybody gets the same foundation stone, and from there we construct a very individualized treatment plan from that, and one that meets their needs. Because everybody is also, we have to be aware, and we always have to look from the very first day that somebody comes in, we have to look to the day that they leave us and prepare them for that as well. Whether it's a referral on to other services, whether it's a referral on to continuing care in terms of counselling, into our aftercare system, of what their home environment is as well. So we have to look at all areas of the person, because addiction doesn't happen in isolation. I believe the most important therapeutic intervention people receive in Smarmore is group therapy. And for a number of reasons. Addiction is a condition that requires isolation, chronic isolation oftentimes. So in other words, the person who's addicted has to and is driven to keep everybody who cares about them out of their life in some way or fashion. It is like this invisible wall that's built between them and the ones who love them the most. We have to help break through that isolation, and the best way to do that is through the process of group therapy, where everybody begins the process of being seen by people who really understand addiction. And the best people who understand addiction are the fellow patients within Smarmore. And they can begin to be seen, and they can begin to be heard and understood and identified with. And this really breaks through the inherent shame that comes with addiction as well. Because now we have a process of pushing through the isolation, pushing through the shame, and being met in a way that's caring and compassionate and real, and oftentimes that's the first time anybody's ever really encountered that. So the group, and within the group therapy, then sometimes, you know, unfortunate fact of addiction is a level of denial that comes with it. It's one of the only conditions that tells the sufferer it doesn't have it. They don't have it. It's one of the only conditions that tells the sufferer that they don't have it. So oftentimes it requires peers who know the person, who's lived with the person, to actually help them through the process of denial, to help show them where the denial exists within their life. And that can be done no better way than through the process of group therapy. But supplementing that, because nothing happens in isolation. The addiction didn't happen in isolation, so the recovery doesn't happen in isolation, is the support from their one-to-one therapist. So everybody's receive a case manager who looks after them, and they go to see them as well on a one-to-one therapy sessions a couple of times a week. And that's another really important part, because that's where maybe the things that are very, very difficult to open up about, they can be begun to look at in the safe space between themselves and the therapist. So I would say that those two would be, and then again, another huge factor is the non-therapy time people spend together within the community. Just spending time together, spending time in downtime also, you know, and engaging with each other and connecting with each other. There's a common phrase out there that you know, addiction is about disconnection and recovery is about connection, and the whole experience of treatment is about connection. It's connecting with us as a team. It's about us connecting with each patient that come in, and it's about the therapeutic community themselves connecting with each other and learning to care for and learning to receive care from each other.